Two of the larger cases that I've had involve, the first one, it was an industrial injury where the person had his hand caught in a machine and it burned all of the extensor tendons on the back of his hand, and he needed a graft done, so they did skin grafting, and then they also had to do a graft where it was attached to his belly to get vessels to come into that area and supply that. And he actually is doing excellent. That was a few years ago, and it took quite a few surgeries and quite a lot of therapy, but he was very determined and it was very successful. And he's a dad and does all sorts of things with work and is still working full-time doing the same job he was doing before. And then we have other dramatic injuries like a frostbite injury where a person loses their fingers, or we get a lot of saw injuries where people lose their fingers, and you figure out ways for them in order to cope with that, are prosthetics. So we can do the new myoelectric hands are pretty impressive. I had a person who lost her entire hand and wrist in an industrial accident and trained her with a myoelectric, and she did everything except she wanted to be able to quilt. And because they don't have sensation, she couldn't feel the needle on the underside. So we figured a way for her to quilt, pushing down, reaching under and touching it. So as long as they're willing to work with it, it's really rewarding to help people get back to their normal self after such traumatic injuries, such as losing fingers or an entire hand.